Welcome to today's event, to the Hope is Big as Texas Share the Care event. Special thank you to veterans and family of veterans that showed up today. Thank you so much. We're all here. We're all here to support the CurePSP Respite Fund. For those who aren't familiar with CurePSP, or PSP in particular, progressive supranuclear palsy, sometimes referred to as a Parkinsonian condition, is a rare neurological disorder that progressively affects body movement, vision, speech, and other functions. CurePSP was founded in 1990, about 15 years after PSP was discovered as a condition. The mission of CurePSP is to raise awareness, build community, improve care, and find a cure for PSP, as well as two other Parkinsonian conditions, corticobasal degeneration and multiple system atrophy. Now, what we're all here for is the CurePSP Respite Fund that provides 60 hours of in-home care, capable, professionally trained, for people struggling with mobility to help with light housekeeping, cooking, and transfers. The cost of it is around $1,890. This cost has increased about 25% since 2020, so as you can imagine, it has become increasingly inaccessible to families to have respite care in the home, which is what makes today's event so important. At the same time, studies have shown that families with respite care have significantly decreased caregiver burden. In addition, they're able to keep the person with PSP in the home for a much longer period of time than they would otherwise. So just the schedule of today's events. First, we're going to hear via video from a couple of people. One, a government executive who has family experience with PSP, and another professor who studies the space. And then we have in person with us someone who has received a grant in the past, as well as people who work at centers of excellence for PSP. After that, we're going to go to the great room to finish up bidding on the beautiful silent auction items out there. Just as a reminder, 100% of the proceeds raised here today go directly to fund respite care, as well as purchase raffle tickets out there. And before I put it up for the videos, I want to give a special thank you to the sponsors here today. Today's event would not be possible without them. Belmont Senior Living, which is where we are, has always been generous to us, so thank you so much. Lundbeck Pharmaceuticals, Parkinson Voice Project, Kerwin Medical Center, Pathway Hospice, Home Health Companions, and Overture Home Care. So I think with that, we'll show the first video. The first video is from Henry Cisneros, who's a seasoned government executive. He was mayor of San Antonio from 1982 to 1989. He also served under President Bill Clinton as HUD secretary for about 6 or 7 years. So,
good afternoon, and thank you for joining us this afternoon for this fundraising event for CurePSP, an organization of compassionate people who've come together to deal with those who are suffering from this degenerative disease, PSP, and supporting the caregivers and family members of those who are assisting those who are suffering from PSP. I know about this disease because my sister Pauline Paulette died from PSP several years ago. This is a person who had been full of life, a wonderful sister, a great family member, an inspiring aunt, a motivator of young people, a respected person in her career, and to watch her pass that way over 6 difficult years. It affected all of our family. Like many other caregivers, we had to change our lives. My sister Tina came all the way from New Jersey, retired here, moved here at the end of her career in order to be able to support Pauline in those last years. And we saw many other families that we worked with through CurePSP dealing with the effects of this insidious disease. AARP tells us that there are 3.4 million Texas families providing unpaid care to an adult family member, frequently from a degenerative brain disease like PSP. The National Alliance for Caregiving tells us that those caregivers expend about 44.6 hours a week caring for someone. Now think of that. 44.6 hours is more than a 40-hour work week. And that comes on top of the time spent dealing with other family obligations, frequently having to work. This is a really tough problem for many people, and frankly, the disease claims other victims besides the person who has PSP, the persons who get sick, overwhelmed, overburdened with the caregiving responsibilities. CurePSP, this organization that is doing this magnificently compassionate work, has created a special program called the Quality of Life Respite Grant Program. And it's designed to provide, at a minimum, some money that the caregiver can get a break and recharge. Go out and take care of responsibilities, family responsibilities, get groceries, go to the pharmacy and get medicines that are necessary in the family, and have some money to be able to have a caregiver. In addition, there are parts of the grant that might be available for longer term caregiving. All of this is important so that the caregiver can get a break, can recharge. The caregiver who otherwise would be overwhelmed and personally stressed. Please join me as I honor my sister's memory, as well as the memory of all of those who have passed from PSP and those who are suffering from it today. Let us join together and support the caregivers. We may not be able to change the course yet, although CurePSP is working on trying to find the solutions in research and science to PSP. We may not have the answers today, but we can help. And one of the ways we can help the people who are suffering is to help those who are providing care. Let us support the caregivers and do something significant to break the cycle of despair and desolation associated with this disease. Please help us share the care. Thank you for your unwavering support of CurePSP. Thank you for your understanding of the difficulties associated with this disease. Together, we can make a difference, and we can bring hope. We can bring hope to families that presently find themselves in what they believe are hopeless situations. We can bring hope to the caregivers, knowing that there is support and there is help there. Perhaps the greatest hope is just the knowledge that someone else cares, that they're not alone. Let's work together. Let's support CurePSP, and let's share the care.
Great. Well, next is a video from Dr. Joy Fleischer. Dr. Fleischer is an associate professor in the Department of Neurological Sciences at Rush Medical College in Chicago. Her passion and clinical and research focus is on treating people with late Parkinsonism.
Hi, everyone. My name is Dr. Jory Fleischer, and it is such an honor to be here with you virtually today. So I have the pleasure of talking about supporting family caregivers of individuals living with Parkinsonism. So some of what I'm going to talk about is not explicitly tied to PSP, MSA, or cortical basal syndrome, but maybe very adjacent to it, and I think, very relevant to our PSP, MSA, cortical basal caregivers and patients. So here's what we know. Here's the landscape of caregiving for individuals living with Parkinsonism. So this is a photo from the Disney movie Encanto, and Louisa is the sister who kind of carries the weight of the world, literally. So our caregivers for individuals living with Parkinsonism, we know, are overburdened and understudied. In general, we know that over 83% of people living with Parkinson's and Lewy body dementia, so some more common conditions, over 83% of community living individuals rely on unpaid caregiving from their family members. That translates to 18.5 billion hours of care, valued at over $232 billion annually. That is a tremendous amount of time and labor spent on caregiving. And what we know from the Parkinson's world is that Parkinson's family caregivers have higher caregiver strain, burden, and depression than caregivers of people with Alzheimer's and related dementias. And I think we don't have the data yet, but thinking about our PSP and MSA and cortical basal families, we know that our Parkinson's folks, that caregiver strain seems to be more because it's not just the cognitive, it's also the physical. It's also all of the non-motor things, swallowing challenges, apathy, mood changes. And we know in our individuals with atypical Parkinsonisms like PSP and MSA, that is all the more true. So we have every reason to expect that these numbers would be higher in PSP, MSA, cortical basal family caregivers. We also know that caregiver strain independently predicts the person living with the disease, their rate of hospitalization, and whether or not and how soon they are placed into a nursing home, which tells us that if we can intervene and help support those family caregivers, that should translate into helping that individual diagnosed with the condition. And it seems like the answer should be, well, why can't we just hire someone? Aren't there paid caregivers? Unfortunately, that cavalry is not coming, at least yet. And so paid caregiving is not typically covered by insurance, including Medicare or hospice. Paid caregiving is extremely expensive. It is in very high demand and very low supply. And that was true before COVID, but has only gotten worse. There's a very high turnover rate and very high burnout rate among paid caregivers. And again, bad before COVID, worse afterwards. So thinking that just hiring paid caregivers for the long term is a sustainable option, unfortunately, is not the case for many people. So what else can we do? I'm going to speak to some other models that we may be able to use to help support people in the future, but I think this really speaks to the value of the quality of life respite grants, even to give a family caregiver a few days of a break, a few days of help so that they can take care of their own health, take a break, go to a family event, right? And know that their loved one is in good hands. So what do we know specifically about caregivers of individuals living with PSP, MSA, CBS? There's a great study that was published earlier this year that really tried to capture what are the emotions that people go through. So there's hope as the caregiver tries to stay positive, but also struggles with sadness, with feeling depressed. The individual with the diagnosis and the caregiver may feel really trapped in their home. They may feel really socially isolated. They may have feelings of guilt, both the person with the diagnosis feeling guilty for their caregiver, sort of having to take on so many responsibilities, and the caregiver may feel guilty having to sort of be the person putting down the rules for their loved one. People can express feeling grateful for the support that they've received while also still being sad. I think this is a land in which people have yes and, or they're living multiple realities, right? You can feel many things at once. There's also apathy that goes along with these diagnoses where people lose the motivation to do the things that they used to enjoy or love. And so much frustration over the decline, the daily struggles that can go along with these conditions, the real impact to daily living, to being able to participate meaningfully, the ways that the person might have used to participate. So there's a lot that caregivers are going through. And I think I put this on here. So this is a recent, just last year, the American Academy of Neurology updated their guideline, their position statement on neuropalliative care. And a lot of us hear the word palliative and we kind of take a breath. There's a lot of stigma associated with that word. But number one, I want to point out that the word palliative actually comes from Latin, from blanket. So it actually comes from a word that means to wrap someone in care. And that's what palliative care is. And I put this up here because within this posting, within this guideline statement from the main Society for Neurologists, what they said verbatim is, as they will likely be the main source of symptom management and support for a number of years, primary neurologists must strive to anticipate and treat symptoms, recognize and address psychosocial and spiritual distress and caregiver burden, engage patients and families in advanced care planning prior to the onset of cognitive impairment, and identify opportunities for specialty palliative care intervention on a case-by-case basis. Why am I putting this here? Caregiver burden features heavily. It's front and center. We have to do more for our caregivers as a way to do more for the patients, for our people living with these diagnoses, because none of these diagnoses affect a person. They affect a family and a social circle. So what do we know? Again, we know that strain is really high. And in a study that my team did when we were in New York, we found that strain was quite high among caregivers of homebound individuals living with advanced Parkinson's disease. So we launched a home visit program where we went as a nurse, a social worker, and a movement disorders neurologist out to the homes. We did over 400 home visits. And we found that even though we could stabilize how our patients did, we kept quality of life the same. Over 1 year, caregiver strain worsened. And so it became clear that while home visits might have a kernel of help in there, it might be really beneficial for our patients, it wasn't enough for our care partners. So we decided to build on this home visit intervention to better support our caregivers. And what we did, moving here to Chicago, which is where I am based, and if you hear noise, that's our pink line, that's the subway going by. So in a study called In-Home PD, we enrolled 65 patient caregiver pairs where the patient had advanced Parkinson's disease and was homebound, and their family caregiver. So they enrolled as a dynamic duo. And they received home visits. But in addition, to add that extra piece for our caregivers, we added in what is called peer mentoring. So we recruited and trained 34 experienced caregivers, some who were still caregiving for a loved one, some whose loved one had passed away, some whose loved ones had had Parkinson's, and some whose loved ones had had PSP, MSA, cortical basal syndrome. And recruiting and training those folks was made possible by CurePSP. So all of the results of this wouldn't have been possible without the support of this phenomenal organization. And so what we found, we trained people, we trained these mentors, we paired them up with the homebound caregivers for 16 weeks and said basically, look, I, as the doc, sitting here in my office, I will never know what it's like at 3 a.m. when your loved one wakes up and is choking, or when there's a safety concern, or someone is hallucinating. I can't speak to that experience directly, but I know someone who can, and they will call you once a week and you can talk with them. And we gave them some thoughts about things they might want to talk about, but we really left it up to the mentor and the mentee to sort of have some help finding their own way. We trained those mentors with about 6 hours of in-person training. We gave them a brief handbook, pretty simple. This is the table of contents over here that just talked about, things that you might want to consider. And what we found was, compared to a control group of people with Parkinson's and their caregivers, that the caregivers in this program, and in-home PD, they started off with greater strain than others, but that strain stayed stable over 1 year. It didn't decline the way we'd seen it before with our first home visit program that didn't involve peer mentors. So we thought maybe we're onto something. Maybe this is working. And here's some of the data there, which is that out of the eligible caregivers, who are the caregivers to someone who is homebound, 51 said, yes, I'll do this. I don't know who's going to call me, but I'll try this. And over those 16 weeks, they averaged about 11 calls per pair. They talked for about 30 minutes each. And when we asked them to rate their satisfaction with just this mentoring program on a scale of 1 to 100, the average was 91. So people were quite happy with this. And we found a little bit of a trend suggesting that maybe just within those 16 weeks of the program, our caregivers' anxiety improved a little bit. Not huge, but just over the course of a couple of weeks. So that's really encouraging. And what that made us think was, we're onto something here. Let's see what we can do. And so our next step was through funding from the NIH, Lewy Body Dementia Association, and Parkinson's Foundation. We launched a study where we enrolled and held focus groups of some of those mentors, some of those mentees, and some care partners who had never been part of the program, and said, here's what we did before. Do you think that this would be helpful? What else should we talk about? Is this handbook enough, or do you need more than that? We enrolled people entirely virtually. So this was all during COVID, and we opened this up nationally, paired with foundations, and they reached out to their email lists and Facebook groups, and people kind of came to us online. We trained 36 new mentors from all across the United States, all virtually. We recruited 30 new mentees, and we matched people up using a card sorting test to say, okay, this person seems like they'd be a good fit for this person. It was like a dating app, but very analog. And we asked them to communicate by phone or by video conference for 16 weeks using the revised curriculum that we fixed based on their feedback. And so here's what we found, and we call this learning to persevere. We found among our 30 mentor-mentee pairs, they completed over 400 calls, which worked out to an average of 15 calls per pair over 16 weeks. And they talked for an average of 45 minutes. We didn't actually give them guidance on how long to talk. So this is kind of all on them. Some talked for 2 hours every week. 100% found the calls useful. 100% said that they would recommend this to other LBD caregivers. And 90% of the mentors said, even though we thought this was a lot to ask of someone, 90% of the mentors said, call me in next time, coach. I'm ready to do this for someone else. And what was even more encouraging was among the mentees, half of them said, I'm ready to become a mentor to someone else next time. So this idea that without a reliable source and coverage for paid caregiving in the long term, we need a better pipeline. We need someone else. We need to tap into another population. And it looks like we may be able to tap into the population of caregivers themselves to help each other and pull each other along in an almost generational fashion, helping the folks who come after them. We found that our mentors, really experienced folks, still improved their knowledge about this condition, and our mentees improved in their knowledge, but also in their confidence and their attitudes towards caring for someone and communicating with someone with dementia, and they even improved a little bit in their depression. So I just want to share with you some of the quotations because I think the numbers say one thing, but to hear what really resonated with people says something even more. So one of the mentors, for example, says, I think I helped my mentee, and she certainly was a help to me to practice good caregiving. The team did an amazing job of matching. We had so much in common that was unique. I loved that I was able to help someone. Someone else said, being a part of something outside of my four walls. So this was all during COVID. Gaining a friend. The mentors and mentees really didn't see each other in a hierarchy, but rather as peers and as friends. The affirmation that someone had something to offer, that all of that lived knowledge and 24/7 caregiving was of value, not only to their loved one, but to someone else in this journey. And so we got a lot of feedback, again, from participants who wanted to change things, make it a website, adapt things. And so thankfully, we were able to get additional grant funding, make those adaptations. And now, as we're filming this in July of 2023, we are awaiting notice from the NIH of the ability to launch a national randomized controlled trial focused this time on Lewy body dementia, which is that combination of Parkinson's and dementia with Lewy bodies, testing this idea, this peer mentoring intervention. And our hope long term is to be able to translate this to other neurodegenerative conditions like PSP, MSA, and cortical basal syndrome. So stay tuned because we'll be looking for outstanding family caregivers in the future for this. So in the meantime, what do we know? We know that family caregivers need helping hands today. We know that peer mentoring may be one of many possible solutions, including paid respite care, such as a CurePSP Quality of Life Respite Care Grant. So tremendous thanks to all of you for watching this, for supporting this funding mechanism and supporting other families. I just want to acknowledge for the research that I presented today, most importantly, our patients, our caregivers, our care partners, and our families. This is my team, my mentors and advisors, importantly, my mentees, because they will carry on all of these things, and all of our funders, including CurePSP. So with that, I thank you so much for your attention and all that you do every day related to PSP, MSA, and cortical basal. Be well.
I'm Jessica Shore. I am the Director of Clinical Affairs and Advocacy here at CurePSP. I've been here for just over 2 years after having the honor of working directly with this community of Parkinson's disease, PSP, CBD, and MSA for almost 10 years as a clinical social worker. Before I introduce who I want to introduce, I just have to say, because this hasn't been said yet, Eileen Thank you for putting this on. Eileen's passion and dedication to this community and energy is unparalleled, and we would not be here today, and this respite program wouldn't be what it is today without you. And the legacy of your husband and every life who you have touched through your support group and spoken individually with as a peer supporter just lives on through everything you have done for us. So I can't thank you enough, Eileen. And I also have to acknowledge that our events team, we have Grace, we have Jacqueline, they were integral in putting this on as well. So thank you both. And the amazing committee that came together, to have you all here today and put this all together. So claps all around. So it's my honor at CurePSP to have the quality of life respite program as one of the many things that we do under our 3 pillars of care, consciousness, and cure. This is, a pillar of consciousness, right? And care and cure, all of it, right? So we have to support people living with these diseases today to live the best quality of life that they can, while we're also striving to improve research and better treatments and find a cure eventually. People living with these diseases every day, you're the boots on the ground, you're figuring out, and your perseverance and your resilience is why we're here and what inspires us. And if we could give more than 60 hours of paid professional care, we would, but it is something that we take a lot of pride in, being able to support this community in this very tangible, very specific way. I'll tell you, with this program, since I started here 2 years ago, we were giving 10 grants per quarter. So we do this on a quarterly basis. We have a small committee that gets together, reads pays a lot of attention to all the details in these applications. We take this very seriously, and it was always hard to figure out, how do I give only 10 grants out? So then, through the support of our donors and events like Hope is Big as Texas, we were able to increase that to 15 grants per quarter last year. And still we were like, that's not enough. So then a few months ago, we increased it to 20 grants per quarter. And we hope to keep going from there. And that is only because of support of people like you in this room. So thank you all so much. So at this point, I would like to introduce a true experts, the real people why we're here today, our family. Are you ready to come and chat with us, Tanya and Tanika? Oh. Yeah? So it's just, as staff, as volunteers, as clinicians, we can tell you all the stats about caregiving, but it's the people who are living this every day, and through your strength and your dedication to your mom, Virgie, I had the pleasure of meeting this family the last time I was in Dallas a year and a half ago, and we were able to give them a grant. Was it last year? Yeah, last year. And when their application came through, there was no question. I was like, I met this family. We have to support this family. They all came together to support their amazing mom, and they're going to share their story with you and what this grant meant to them. So thank you all so much.
Before we get started, I do want to acknowledge our beautiful mother, Virgie, at the back. Her being here today is a testament to the support that she's received from CurePSP. We've reached out to Eileen for help, service, and support. It's connected us so that she is here today. She was on her walker, walking, smiling, eating. So all of these things, as you know, in this community is pretty amazing, right? So we're honored, Mom, that we get to be here in support of you and acknowledging you. But as Jessica said, we received a grant, but I want to start off by saying who my mother is, who our mother is. This is a woman who was an electronic assembler, who worked in a male-dominated field. I've seen her in her attire, standing with her, 7 male colleagues and her holding her own as she was working and reading blueprints and schematics. A woman who was active, was walking 3 and 4 miles a day before she was diagnosed. A woman who had a C-section and days later went to a job interview. As someone who's expecting a baby, I don't know how she was able to do that. But I think, again, it's a testament to her will and her strength and why being a caregiver is an honor for the both of us. My sister Tanika, who is the everyday caregiver, the boots on the ground, who does a lot of the bathing, feeding, and care. And I just do the administrative, legal, financial stuff. So she is the one who is here, who really makes it happen. So we wanted to just start and just tell you about this grant and what it means to us. I'll let you close this out. So with CurePSP, as you know, the diagnosis is so hard. And we were trying to figure out what is wrong, something is different, something is off. And so, we were living our lives and knew some things were off. And then unfortunately, my mom's husband passed. And we didn't realize that he had been picking her up off the floor as often as he had, making sure that she was getting what she needed. So it was a shock to us all when he passed and we saw what was going on with Mom. Jack and I worked full-time, demanding jobs, and we had to quickly pivot and try to figure out overnight how to care for Mom, which she, of course, didn't feel like she needed any care. Fiercely independent woman, but we knew that things were different. Our way of life, as we had known it, had changed. And so how do we go forward? So we quickly tried to find out more about CurePSP. So of course we start with the website, found out about the support group, went to that, and trying to just make sense of all of the, what's happening? What do we need next? Or how do we get a wheelchair? Does she need one now? All of those things that we were just trying to make sense of. And so along the way, as we got connected to the support group, Eileen, as Jessica mentioned, they came to the house and talked to Mom, what is it like with this condition and being a caregiver and the strain that we were under. Luckily, my sister made the sacrifice to leave her place, move in with Mom to be the full-time caregiver. I live an hour and a half away and can only do so much. So just a tremendous strain on the family. And then we found out about the quality of life respite grant. And so this was a lifeline. This was an absolute lifeline for us at a time when we had no real other options on how to figure out the everyday care for Mom. And so it allowed us to look at agencies, find out what's the average rate, how does this work, what services and care could we receive? And so out of it, we had a wonderful caregiver. I don't know if you want to talk about Miss Mary and some of the things that she did.
Mary was the first caregiver that came out, and she was really awesome. She did dishes, she cooked, she did laundry. You didn't have to ask her to do anything. If she stood there too long, she would be like, I do you need me to do something else? I'm like, you can sit down. You can take a break. But she was constantly, she knew, and she didn't mind driving her she liked taking her to do things that she was used to doing. And that was a big help, especially at the beginning, because she liked getting her nails done and she liked going out to eat and doing those things. And I wasn't able to do it because I had to work full time. So she came in and, she was like, yeah, where do you want me to go? And you just give her the directions and she was out the door, they were gone. So it was really helpful having them come in, and each one of them, every time one would maybe change or if we had to use someone different, every one of them had a different skill that they were really good at. I remember Jeanette, I think was her name, and she was always very cheerful. When she came in, she was like, let's go, you know? So it was really, really helpful. And it helped us kind of figure out while they were helping take care of her, for us to figure out what our next move was. And that was really helpful. It gave us kind of a break for me to be able to, you know, for me and her to kind of put our heads together without having to worry about her, you know, just for a minute, you know, that she was gonna be okay, because Mary followed her around to make sure she didn't fall, and she knew how to use all the equipment, you know, all the stuff, and it was helpful, so.
It really gave mom the quality of life, right? That's what the grant is about. It's not just someone to babysit or, you know, clean someone up, but to really give them a sense of what things were like before they were diagnosed. And so movies and her nails done, all of those things she got to do. And, you know, this, you know, just PSP and I think all of the degenerative diseases are such a harrowing journey. I know it's different for everybody. And it's a hard thing to navigate, to find the resources. And so that's why we are extremely grateful to CurePSP for helping us just walk along with us on this journey. Because a lot of things we don't know. I mean, I called Eileen 3 weeks ago, like, we need hospice. Where do we go? What do? We don't know the steps. And so being able to have that resource, and especially with diseases that are lesser known, that people may not know, or even giving us the knowledge of how to talk to doctors who may not be knowledgeable, right? And so it has been just a blessing to us, and has helped sustain our family in a very difficult time. So we are extremely grateful to CurePSP, all the donors, all the people here who really have made this happen, and impacted our lives personally. We are very excited to see that the grant has changed. It used to be a dollar amount, now it's hours. And I think it's just a testament to how CurePSP continues to evolve in its focus on the needs of the patients and caregivers. So we are just grateful to everyone. Thank you for this opportunity and how you've impacted and changed our lives.
And congratulations. Thank you for sharing your story. Virgie, thank you for being here. Got you, ladies. So now I'd like to introduce another speaker. Dr. Lynn, would you like to join me? So one of the things that I get to do at CurePSP, and have really relaunched and reset and grown over the past 2 years, is our Centers of Care program. So this is 31 medical centers across the United States and then 2 in Canada, all of which meet designation criteria around specialized services and care and research for PSP and CBD, some for MSA as well. And I believe in the collaborative nature of this network. We cannot pretend to improve care or to find a cure without getting people who are working in that field talking with one another, right? It's too big to be solved by any one doctor, any one organization, any one medical center. So we have to utilize all this collective brain power. We were really fortunate to bring on a new center of care just a few months ago, which is Baylor College of Medicine. And I have Dr. Roy Lynn here, who is the Center of Care Director, and he's going to tell you a little bit about that. So they're based out of Houston, and here in Dallas, we also have Kerwin Research Medical Center, who is a sponsor of this event. We're hoping just to grow our presence and our care services in Texas in the coming years. So I'd love for Dr. Lynn to tell us a little bit about what they're doing and what they're hoping to do with us. Thank you for being here.
Thank you, Jessica, for the wonderful introduction. And it's a great pleasure to be here. I'm Dr. Roy Lynn. I'm a movement disorder neurologist and Director of Baylor's CurePSP Center of Care. I'm here with my clinical research manager, Mr. Rory Mahabar. Rory, do you want to wave your hand? To meet the community and introduce our center. And we'll talk about what to expect for in Baylor CurePSP Center of Care. So the Baylor CurePSP Center of Care is under Baylor's Parkinson's Disease Center of Movement Disorder Clinic, and we are part of the Department of Neurology. We now totally have 7 movement disorder neurologist faculty and 1 nurse practitioner and 2 pediatric movement disorder neurologists taking people with movement disorders, including Parkinson plus syndrome. And as one of the main academic centers of the country, we envision ourselves to excel in clinical care, education, and research. So we are very honored to be designated by the CurePSP as a newly designated center of care. In addition to that, we are also Center of Excellence by Parkinson Foundation, Tourette Association, and Wilson Disease Association. We aim to train the future movement disorder neurologists, so we have nationally and internationally recognized fellowship program in movement disorders, and we actively conduct clinical and translation research with a lot of great scientific publication in Parkinson and atypical Parkinson movement disorders. So why Baylor College of Medicine applied for and joined CurePSP Center of Care? Because our vision align, CurePSP's vision align with Baylor's. We all believe that collaborating work can advance the patient care and advance the science. So by joining CurePSP, we aim to collaborate with the Center of Care Network to promote the research efforts to enhance the awareness and resources of PSP and other atypical Parkinson disorders, and to improve diagnostic accuracy. We now have skin biopsy service in Baylor to improve the diagnostic accuracy of the PSP versus other Parkinsonian disorders. So what to expect at Baylor College of Medicine Center of Care in the next 1 to 2 years. So we were newly selected as a clinical trial site for the upcoming PSP phase 3 clinical trial. We won't have time to talk about the details of the mechanism of the drug, but overall, the drug is aiming to reduce the neuronal death. We were newly awarded, thanks to CurePSP's generosity, we were newly awarded with the CurePSP Cares Grant to study the art therapies therapeutic effect in people with PSP. We aim to study and confirm the feasibility of the art therapy and to study how art therapy's therapeutic effect could alleviate caregiver stress and to promote the quality of life in people with PSP. And the Association of Frontotemporal Degeneration is one of the associations that CurePSP has worked with. Next May 3rd in Houston, they're gonna have their annual education conference. And I'm going to give an educational talk about PSP and CBD, focusing on the cognitive and emotional changes. Especially, I want to talk about the disease trajectory, because some people with PSP or CBD, initially they presented with more frontotemporal lobar degeneration, more emotional behavioral symptom, or language disorder symptom like primary progressive aphasia. And later, the motor features of the PSP or CBD emerge. So with this talk, we aim to give people a overarching general picture to avoid the unexpected surprise along the disease trajectory. So with that, thank you, everyone. Thanks, Jessica, for your exemplary and innovative leadership. Thanks to the whole community, and I look forward to more discussion after today. Thank you.